As the body ages, it begins to change in quiet ways that often go unnoticed until symptoms start to appear. And one of the most overlooked changes after the age of 60 is the body's declining ability to absorb essential nutrients, especially vitamin B12. This vitamin is not just another supplement. It plays a central role in keeping your nerves healthy, your brain sharp, and your heart functioning properly. Yet many people assume that simply eating well or taking a daily multivitamin is enough, without realizing that their body may no longer be processing B12 the way it once did. In younger years, the stomach produces enough acid and a special protein called intrinsic factor, both of which are necessary to absorb vitamin B12 from food. But as we grow older, stomach acid levels naturally decrease. This means that even if you are consuming foods rich in B12 like meat, eggs, or dairy, your body may not be extracting and utilizing this vital nutrient effectively. Over time, this silent decline can lead to a deficiency that affects multiple systems in the body. What makes this even more concerning is how subtle the early symptoms can be. You may feel slightly more tired than usual, a bit forgetful, or notice a mild tingling sensation in your hands and feet. These signs are often brushed off as normal aging, stress, or lack of sleep. But in reality, they can be early warnings that your body is struggling without enough vitamin B12. Left unaddressed, this deficiency can progress into more serious issues such as nerve damage, balance problems, memory decline, and even an increased risk of cardiovascular complications. Vitamin B12 is directly involved in the production of red blood cells, which carry oxygen throughout your body. When B12 levels drop, your body cannot produce healthy red blood cells efficiently, leading to a condition known as anemia. This reduces oxygen delivery to tissues, making you feel weak, dizzy, and short of breath. But beyond that, B12 also helps regulate levels of homocysteine, an amino acid in the blood. When homocysteine levels rise due to low B12, it can damage blood vessels and increase the risk of heart disease, stroke, and other serious cardiovascular conditions. This is why cardiologists are particularly concerned about B12 levels in older adults. It is not just about energy or nerves, but about protecting the heart itself. Another important factor is that many people over 60 are already taking medications that further reduce their ability to absorb B12, even without realizing it. This creates a double challenge. The body is naturally less efficient at absorption, and medications may be making it even harder. As a result, deficiency becomes not just possible, but highly likely if no preventive steps are taken. It is also worth understanding that vitamin B12 is water-soluble, meaning the body does not store large amounts of it for long periods. If intake or absorption is inadequate, levels can gradually decline over time. Unlike some deficiencies that show immediate symptoms, B12 deficiency develops slowly, often over years, making it harder to detect until the effects become more serious. The good news is that this is one of the most preventable and manageable health issues, if you are aware of it. Regular monitoring of B12 levels, especially after the age of 60, can make a significant difference. Simple blood tests can reveal whether your levels are within a healthy range, allowing you to take action early. In some cases, dietary adjustments may be enough, while in others, supplements or even B12 injections may be necessary to restore optimal levels. Understanding the importance of vitamin B12 is not about creating fear, but about empowering yourself with knowledge. When you recognize how essential this nutrient is and how aging affects its absorption, you can take proactive steps to protect your energy, your mind, and your heart. Because sometimes the smallest deficiencies can lead to the biggest health challenges if they are ignored for too long. Take this as your reminder that after 60, your body needs more attention, not less. As we grow older, managing our health often means relying on daily medications to control conditions like high blood pressure, diabetes, or digestive issues. These medications are important, and in many cases they are life-saving. But what many people over the age of 60 don't realize is that combining these medications with certain vitamins, especially vitamin B12, can create hidden risks that develop slowly over time. It's not always about a dangerous reaction happening instantly, but rather a silent interference inside the body that gradually affects how nutrients are absorbed and used. Vitamin B12 plays a crucial role in maintaining nerve health, supporting brain function, and protecting the cardiovascular system. However, when it is taken alongside certain common medications, its effectiveness can be reduced or altered. This means that even if you are doing the right thing by taking a B12 supplement, your body may not actually be benefiting from it the way you expect. In some cases, the interaction can even lead to worsening symptoms that are mistakenly blamed on aging or existing health conditions. One of the biggest challenges is that these interactions are not widely discussed. Many people assume that vitamins are always safe to take with medications because they are natural. But the truth is, once inside the body, vitamins and medications share the same absorption pathways, compete for the same resources, and can influence each other's effects. For someone over 60 whose body is already undergoing changes in metabolism and digestion, this interaction becomes even more significant. The danger lies in how quietly these issues develop. You might be taking your prescribed medication every day, along with a vitamin B12 supplement, believing you are supporting your health. But over time, you begin to feel more fatigued, experience tingling in your hands or feet, or notice memory lapses. These symptoms may seem unrelated, but they can actually be signs that your body is not getting enough usable B12 due to medication interference. Instead of improving your health, the combination may be working against you without any clear warning. Another important factor is that many older adults take multiple medications at once. This increases the risk of what is known as polypharmacy, where different drugs interact not only with each other but also with vitamins and minerals. In such situations, the body's ability to maintain balance becomes more complicated. A medication that reduces stomach acid, for example, might prevent proper B12 absorption, while another drug could affect how nutrients are transported or utilized in the bloodstream. Together, these effects can create a chain reaction that slowly impacts your overall health. Cardiologists are particularly concerned about these interactions because of their indirect effect on the heart. When vitamin B12 levels drop due to poor absorption or interference, levels of homocysteine in the blood can rise. Elevated homocysteine is a known risk factor for heart disease, as it can damage blood vessels and promote inflammation. This means that something as simple as a vitamin-medication interaction can quietly increase cardiovascular risk over time, even if you are taking your medications exactly as prescribed. What makes this situation even more challenging is that routine checkups do not always include detailed discussions about vitamin interactions. Unless specifically tested, a B12 deficiency might go unnoticed. Doctors may focus on managing the primary condition, such as blood sugar or blood pressure, while the underlying nutrient imbalance continues to develop in the background. This is why awareness is so important. Understanding that medications and vitamins can interact is the first step toward protecting your health. It doesn't mean you should stop taking your medications or avoid supplements altogether, but it does mean you need a more informed and balanced approach. Timing, dosage, and the form of the vitamin can all make a difference, and these decisions should ideally be made with proper medical guidance. The key message here is simple but powerful. Just because something is common does not mean it is harmless when combined. After 60, your body becomes more sensitive to these interactions, and what once worked fine may no longer be suitable. Paying attention to how your body responds, asking the right questions, and staying informed can help you avoid long-term complications that are often preventable. Because when it comes to your health, it's not just about what you take, but how everything you take works together inside your body. One of the most common and often overlooked medication groups that can interfere with vitamin B12 in people over 60 is acid-reducing drugs, particularly proton pump inhibitors, often called PPIs, and various types of antacids. These medications are widely used to treat conditions like acid reflux, heartburn, and GERD, and for many people, they bring quick and noticeable relief. But what happens behind the scenes in the body tells a very different story, especially when these drugs are used for months or even years. To understand the risk, you first need to understand how vitamin B12 is absorbed. B12 from food does not get absorbed easily on its own. It requires stomach acid to separate it from the protein it is bound to in food. Once released, it then binds with intrinsic factor, a special protein in the stomach, which allows it to be absorbed in the small intestine. This process depends heavily on having enough stomach acid. When you take acid-reducing medications, you are directly lowering the level of acid in your stomach, which means this entire process becomes less efficient. At first, this might not seem like a big issue. You may still feel fine, and your digestion might even feel more comfortable. But over time, as your body continues to receive less usable vitamin B12, your levels begin to drop slowly. This is not something that happens overnight. It can take months or even years before symptoms become noticeable, which is why so many people fail to connect their symptoms to the medication they have been taking regularly. As B12 levels decline, the body begins to show subtle warning signs. You may feel more tired than usual, even after getting enough rest. You might notice a lack of focus, mild memory problems, or a feeling of mental fog. Some people experience tingling or numbness in their hands and feet, a sign that the nerves are not functioning properly. These symptoms are often mistaken for normal aging or stress, but in reality, they can be early indicators of a developing deficiency caused by reduced absorption. What makes this situation more concerning is that many people take these medications long-term without reevaluating whether they still need them. PPIs in particular are often prescribed for short-term use, but patients may continue taking them for years out of habit or fear that their symptoms will return. During this time, the body is continuously deprived of the stomach acid it needs not only for B12 absorption but also for the absorption of other important nutrients like calcium and magnesium. From a cardiovascular perspective, this becomes even more serious. Vitamin B12 plays a key role in controlling homocysteine levels in the blood. When B12 is low, homocysteine levels can rise, which may damage blood vessels and increase the risk of heart disease and stroke. So while you may be taking acid-reducing medication to manage one condition, you could unknowingly be increasing your risk for another, more serious issue over time. Another layer of complexity is that many older adults assume taking a vitamin B12 supplement will solve the problem. But if stomach acid is too low, even supplements may not be properly absorbed in their standard form. This creates a false sense of security, where you believe you are supporting your health but your body is still not receiving what it needs. In such cases, alternative forms like sublingual tablets or injections may be more effective, but these options are rarely considered unless a deficiency is already diagnosed. It's important to understand that acid-reducing medications are not harmful by themselves when used appropriately. They serve an important purpose and can greatly improve quality of life when needed. The issue arises when they are used long-term without monitoring their impact on nutrient absorption. This is especially critical after the age of 60, when the body is already less efficient at absorbing key vitamins. Being aware of this connection gives you the power to take control of your health. If you are using these medications regularly, it may be worth discussing with your healthcare provider whether the dosage is still appropriate, whether you can reduce usage, or whether your vitamin B12 levels should be tested. Sometimes simple adjustments can prevent long-term complications, because the relief you feel today should not come at the cost of your health tomorrow. Another medication that deserves serious attention in this discussion is metformin, one of the most commonly prescribed drugs for managing type 2 diabetes. For millions of people over the age of 60, metformin is a daily essential. It helps control blood sugar levels, improves insulin sensitivity, and plays a key role in preventing complications related to diabetes. On the surface, it is considered safe, effective, and widely trusted. But what many people are not told is how quietly it can interfere with vitamin B12 levels over time. Unlike some medications that cause immediate side effects, metformin works in a more subtle way when it comes to vitamin B12. It affects the absorption process in the small intestine, where B12 is supposed to be taken into the body after binding with intrinsic factor. Over time, metformin reduces the efficiency of this absorption, meaning that even if you are consuming enough B12 through your diet or even taking supplements, your body may not actually be getting enough of it. This becomes particularly dangerous because the symptoms of vitamin B12 deficiency can closely mimic complications of diabetes itself. For example, one of the most common issues faced by people with diabetes is nerve damage, also known as neuropathy. This can cause tingling, numbness, burning sensations, or pain in the hands and feet. But here's where the confusion begins. Vitamin B12 deficiency can cause almost identical symptoms. So, a person taking metformin may start experiencing nerve-related problems and assume it's simply the progression of diabetes, when in reality it could be a preventable or reversible B12 deficiency. This misinterpretation can delay proper diagnosis and treatment. Instead of addressing the root cause, additional medications may be introduced to manage symptoms, creating a cycle where the real issue remains hidden. Over time, the nerve damage can worsen, becoming more difficult to reverse, even if B12 levels are eventually corrected. But the impact doesn't stop at the nerves. Vitamin B12 also plays a crucial role in brain function. Low levels can lead to memory problems, confusion, difficulty concentrating, and even mood changes such as depression or irritability. For someone over 60, these symptoms are often dismissed as normal aging or early signs of cognitive decline. However, in many cases, they may be linked to a simple nutrient deficiency that has been quietly developing due to long-term metformin use. From a cardiovascular standpoint, the risks become even more serious. As mentioned earlier, vitamin B12 helps regulate homocysteine levels in the blood. When B12 is deficient, homocysteine levels can rise, increasing the risk of damage to blood vessels. For someone already managing diabetes, a condition that itself raises the risk of heart disease, this creates a compounded clutter. The combination of diabetes, elevated homocysteine, and potential nerve damage forms a dangerous trio that can significantly impact long-term health outcomes. What makes this situation even more concerning is how common it is. Many people take metformin for years, even decades, without ever having their vitamin B12 levels checked. Routine blood tests for diabetes management typically focus on glucose levels, HbA1c, and kidney function. But B12 is not always included unless there is a specific reason to suspect a deficiency. This means that the problem can go unnoticed for a long time. The good news is that this risk can be managed with awareness and simple preventive steps. Regular monitoring of vitamin B12 levels should be a priority for anyone taking metformin long-term, especially after the age of 60. If levels begin to drop, doctors may recommend supplementation, but not all forms are equally effective. In cases where absorption is impaired, sublingual B12 or injections may be more reliable options as they bypass the digestive system. It's also important to have open conversations with your healthcare provider. Asking whether your current medication could be affecting your nutrient levels is not just a good idea, it's essential. Small adjustments, whether in dosage, supplementation, or monitoring frequency, can make a significant difference in preventing long-term complications. Metformin remains a valuable and often necessary medication, but like any powerful tool, it must be used with full awareness of its effects. Understanding how it interacts with vitamin B12 allows you to take a more complete and informed approach to your health. One that doesn't just manage blood sugar, but protects your nerves, your brain, and your heart as well. Because sometimes the side effect you don't feel right away is the one that matters most in the long run. As the body begins to lose adequate levels of vitamin B12, it rarely sends out loud or dramatic warnings at first. Instead, the signs appear slowly, subtly, and often in ways that are easy to ignore or misinterpret, especially after the age of 60. Many people assume that feeling tired, forgetful, or slightly unsteady is simply a normal part of aging. But in reality, these could be early signals that your body is struggling with a deficiency that is quietly affecting multiple systems at once. One of the most common signs is persistent fatigue. This is not the kind of tiredness that goes away after a good night's sleep. It lingers throughout the day, making even simple tasks feel exhausting. You may find yourself lacking energy, feeling weak, or needing to rest more often than usual. This happens because vitamin B12 is essential for the production of healthy red blood cells, which carry oxygen throughout the body. When B12 levels are low, oxygen delivery becomes less efficient, leaving you feeling drained and sluggish. Another early warning sign is what many people describe as brain fog. You might notice that your memory isn't as sharp as it used to be. You forget names, misplace things more often, or struggle to focus on conversations. At times, you may even feel slightly confused or mentally slow. These changes can be alarming, but they are often dismissed as a natural part of getting older. However, vitamin B12 plays a critical role in maintaining healthy brain function, and a deficiency can directly impact cognitive performance. Nerve-related symptoms are also very common and should never be ignored. You may experience tingling, numbness, or a pins and needles sensation in your hands and feet. Some people describe it as a mild burning feeling or a loss of sensitivity. This occurs because vitamin B12 is essential for maintaining the protective covering around nerves, known as the myelin sheath. When B12 levels drop, this protective layer begins to deteriorate, leading to nerve dysfunction. If left untreated, this damage can become permanent. Balance and coordination issues can also develop over time. You might feel slightly unsteady when walking or notice that your movements are not as smooth as they once were. This increases the risk of falls, which can be particularly dangerous for older adults. Again, this is often mistaken for general weakness or aging, but it may actually be linked to nerve damage caused by low B12 levels. Breathing changes and dizziness are additional warning signs that are frequently overlooked. You may feel short of breath even during light activity or experience occasional lightheadedness when standing up. This ties back to the body's reduced ability to carry oxygen efficiently due to poor red blood cell production. In some cases, people also report heart palpitations, a feeling that the heart is racing or beating irregularly, which can be unsettling and is sometimes connected to anemia caused by B12 deficiency. Mood changes are another important but often ignored symptom. You might feel more irritable, anxious, or even depressed without a clear reason. Emotional well-being is closely linked to brain chemistry, and vitamin B12 plays a role in the production of neurotransmitters that regulate mood. When levels are low, it can affect how you feel mentally and emotionally, not just physically. What makes all of these symptoms particularly dangerous is how easily they can be mistaken for other conditions. Fatigue may be blamed on poor sleep, memory issues on aging, nerve pain on diabetes, and mood changes on stress. This overlap can delay proper diagnosis, allowing the deficiency to worsen over time. By the time it is identified, some of the damage, especially to the nerves, may be difficult to fully reverse. This is why it is so important to listen to your body and take these signs seriously. They are not random or meaningless. They are signals that something deeper may be wrong. A simple blood test can often reveal whether vitamin B12 levels are within a healthy range, providing clarity and direction for treatment. Recognizing these warning signs early can make all the difference, because when your body starts whispering, it's far better to listen before it has to start shouting. Protecting your health after 60 requires more than just taking vitamins or medications. It requires understanding how to take them safely together. Vitamin B12 is essential, but its benefits can be undermined if not managed properly, especially when combined with certain medications. The goal is not to avoid supplements or prescriptions, but to use them wisely so that each supports your health instead of unintentionally interfering with the other. The first step is to consult your healthcare provider before starting any supplement regimen. This is especially important if you are taking long-term medications like PPIs or metformin, which, as we discussed, can reduce B12 absorption. A doctor can recommend the best form of B12, whether it's oral, sublingual, or injectable, to ensure your body actually receives and uses it effectively. They can also check for interactions and help determine the safest timing for taking your vitamins and medications to avoid competition during absorption. Regular monitoring of your blood levels is another key strategy. Vitamin B12 deficiency can develop slowly, and by the time symptoms appear, some effects, particularly